Hi everyone, welcome back to the Pelvic Health Project. I'm Dr. Lena Lloyd, a pelvic health physical therapist. Today, I'm going to answer the very common and broad question I get, which is, what is pelvic health physical therapy? And the simple answer is that pelvic health physical therapy is physical therapy for your nether regions. We treat any dysfunction you may have in the bowel, bladder, and in sexual health. We treat pelvic pain, that means vaginal pain, rectal pain, low back, tailbone, pubic or abdominal pain. We treat men and women after cancer treatment, pelvic surgeries, and then of course in the peripartum stages, which is during pregnancy and beyond. So most commonly, pelvic health physical therapists treat incontinence and pelvic pain. So incontinence, I'll speak about first, doesn't necessarily mean you're having full accidents or wetting your pants. A vast majority of the time, patients come in complaining that they're having some dripping or dribbling with coughing, sneezing, laughing, and on the way to the bathroom. Some patients who may have some weakness toward their posterior or backside of the pelvic floor may have complaints with bowel, meaning that they have trouble holding in gas. They may find some smearing on their underwear. But regardless of whether we have urinary or bowel issues, strengthening your pelvic floor muscles will very likely improve your symptoms. So on the contrary, instead of a weakness or an incontinence issue, we may have a tension or a tightness issue, and that can lead to pelvic pain. So if you are having vaginal, rectal, tailbone pain, lower abdominal pain, pelvic floor muscle tension may be the cause. If you have painful intercourse and you've had a workup with your doctor and they have found nothing wrong, it's possible that you may have pelvic floor muscle tension. So regardless of why you've been referred to pelvic physical therapy, whether for pain or incontinence, your pelvic PT will assess you to find the cause of your symptoms and then treat you accordingly. Usually this will be with exercise, whether a strengthening or stretching program is more appropriate for you. But oftentimes we use a whole host of treatments that can often be manual therapy, neuro retraining, e-stim or biofeedback. There's just a array of things that we use in the office to help our patients depending on their diagnosis. So I hope, I forgot to mention, your pelvic therapist will also prescribe a home program for you. It's really important to have a home program so that you can work things on your own, and that will likely hasten your recovery. So I hope this answers your question on what pelvic floor physical therapy is and what it entails. So stay tuned. I plan to do another series on pelvic pain and painful intercourse. So I hope that would be an interesting topic for you guys. And again, as I always say, please comment, ask me any questions you'd like me to answer in a future video. And thank you so much for tuning in today.